Hey, welcome. So, picture this. You're sitting in the dentist chair, everything's going fine, and then you hear those two little words, deep clean. And you're thinking, wait, what? Is that just a super intense version of a regular clean? Is something wrong? Okay, let's just dive right in and get this all cleared up.
It's such a common question. You go in for your routine checkup, you're expecting the usual scrape and polish, and then bam, you're hearing about a totally different procedure. So today we're going to break it all down, what a deep clean actually is, why your dentist is recommending it, and how it is a whole different ballgame from your standard cleaning.
All right, let's get right to the heart of it. What is the one single thing that separates a regular cleaning from a deep cleaning? Well, you've heard it in real estate, and it's true here too. It all comes down to location, location, location.
Okay, so a regular cleaning, the one you're hopefully getting every 6 months or so, that's all about maintenance. Your hygienist is really focused on the surfaces of your teeth that you can see, everything at or just above the gum line. Think of this as your first line of defense, clearing away all that buildup before it has a chance to cause any real trouble.
And here it is, the big difference. A deep clean, which you might also hear called scaling and root planing, is a specific treatment that targets the area below the gum line. See, this isn't about maintenance anymore. This is about treating a problem that's already started to develop where your toothbrush just can't reach.
So when you boil it all down, the main distinction is super simple. It's about location and time. A regular clean is a much quicker, surface-level job that happens above your gums. A deep clean, well, that's a much more intensive treatment happening below the gum line. And that's exactly why it can take 1, sometimes even 2 hours to get it done right.
So let's talk a little bit more about that routine clean. It's so much more than just making your teeth feel all smooth and shiny. It is an absolutely critical, preventative step for your overall health.
Think of it like this. You're brushing and flossing at home. That's your daily patrol. But the regular professional cleaning, that's when you call in the specialists to make sure no enemy plaque or tartar can set up camp. It's totally proactive, not reactive.
And the benefits of that? They're huge. By staying on top of that surface-level gunk, you're actively preventing all the stuff we want to avoid: tooth decay, cavities, and the early stages of gum disease. This, right here, is the foundation of a healthy mouth.
But what happens when that daily patrol and routine maintenance just isn't quite enough? What happens when trouble starts brewing down where you can't even see it?
This right here is the turning point, because when plaque and tartar manage to sneak past your gum line, they get into this protected little environment where they can do some real damage, leading to inflammation and eventually infection.
This invasion creates something called periodontal pockets. The best way to think of them is like tiny hidden moats around the base of each tooth. Your toothbrush can't get in there, floss can't reach the bottom, which makes them the absolute perfect breeding ground for nasty bacteria.
And believe me, the scale of this problem, it's pretty staggering.
That's right, 25%. 1 in 4 Australian adults is affected by periodontal disease. This is not some rare condition. It's a really widespread, chronic health issue that often starts silently, right down in those hidden pockets.
And that risk, it doesn't stay the same. It actually increases pretty significantly as we get older, jumping to a massive 40% for adults over the age of 55. This just goes to show why that consistent care throughout your entire life is so important.
Because if this is left unchecked, the consequences get really serious. We're not just talking about sore gums anymore. This can progress to the loss of gum tissue and even the bone that supports your teeth, which can lead to loose teeth and, eventually, even tooth loss. And what's really important to know is that it can even cause systemic infections that impact your overall health.
So, here's the crucial point. When your dentist recommends a deep clean, they are not punishing you for anything. They are prescribing a healing treatment. It's designed specifically to stop that destructive process in its tracks and give your gums a real chance to recover.
The whole procedure really happens in 2 main stages. The first one is called scaling. That's the super meticulous removal of all that plaque and tartar buildup from below the gum line, cleaning out those pockets right to the bottom. The second part is root planing, and that's where the surfaces of the tooth's roots get smoothed out.
And that smoothing process is absolutely key. By creating a clean, smooth surface, it actually encourages your gums to heal up and reattach firmly to the tooth. That's what stops the disease from progressing and ultimately makes your tooth stable in your mouth again.
So, the treatment is done. What comes next? Well, the goal isn't just to fix the immediate problem. It's to make sure that problem doesn't come back.
It's totally normal to have some sensitivity for a few days or even up to a week after the procedure, but your dentist can help you manage that, no problem. You'll have a follow-up visit to check how you're healing, and from that point on, great home care becomes more important than ever to keep this from happening again.
And really, this one sentence says it all. While a deep clean is an incredibly effective and necessary treatment, the ultimate goal is always prevention. Diligent care at home and those regular routine cleanings are, without a doubt, the best way to make sure you never need one in the first place.
Which brings us to our final thought. That regular checkup is your #1 tool for staying ahead of the game and keeping your smile healthy from the root all the way up. Thanks for tuning in.